Hello, my name is Dr. Marisa Donatelli, and in conjunction with my colleagues Dr. Leon and Behar from the Columbia University Division of Cardiology at Mount Sinai Medical Center, Miami Beach, we're very excited to bring you our research today on the short-term outcomes of orbital mechanical atherectomy in patients with severe aortic stenosis. So orbital atherectomy, or OA, is a method of modifying the calcific plaques prior to PCI, or percutaneous coronary intervention, or stent placement. Previously, OA has been shown to be safe and effective in the calcific plaque modifications prior to PCI. However, very little data has been shown about the safety and effectiveness of OA in patients with severe aortic stenosis. We performed a retrospective study evaluating the clinical outcomes of OA in patients with and without severe aortic stenosis. We did this by collecting all patients undergoing OA at our institution from January 2014 to June of 2020 were included in the analysis. We retrospectively collected pre-procedural clinical data and post-procedural outcomes using our institution's CathPCI database. The primary safety endpoint was freedom from major cardiac events, or MACE, at 1 month, and the primary effective endpoint was stent delivery with less than 50% residual stenosis. So, our results showed that of all of the PCIs that were done during the time window, 609 underwent OA prior to their PCI placement. 32 of those patients had severe aortic stenosis. The average age of the severe aortic stenosis patients, as expected, was older at 80 years of age plus or minus 9 and 73 years of age plus or minus 9 in those without aortic stenosis. That being said, there were no differences in the remaining clinical data or procedural data collected between the two groups, which you can see in your middle table in the middle of your screen. There was no difference in the primary effective endpoint between the patients with and without severe stenosis, and the primary effective endpoint was achieved in all patients in both groups. There was no statistically significant difference in severe angiographic complication rates between the two groups as well, which you can see in the table on the right side of your screen, table 2. So we're very excited about this data because it shows that OA appears to be safe and effective in calcific plaque modifications prior to PCI in patients with severe aortic stenosis. This is pertinent because it's becoming more and more common for patients with severe aortic stenosis to undergo a coronary angiography prior to their procedure, whether it be percutaneous or surgical. And when found to have very complex lesions with older patients, they tend to be more calcific and harder plaques to be intervened on. So therefore, having a method such as OA available to us to modify those plaques and allow for a more sufficient PCI to be performed is very beneficial. And now we've shown that it's just as safe and effective as those patients without aortic stenosis. So therefore, we definitely have a small patient population of only 32 patients, so this study would need to be expanded, possibly randomized, to be able to be kind of generalized. However, it's very exciting data, and we're so happy we were able to share it with you today. If you have any questions, please reach out. We're happy to address those. Otherwise, have a lovely day.